everyone. Thank you for being here, joining me on CORA's Facebook page on this Wednesday. I'm Anju Dheer. I am a board certified orthopedic specialist in our Louisburg, North Carolina clinic. I'm excited to be here to talk about some general rehab principles after shoulder surgery. Before we get started, I just want to make sure we all understand every surgery is different. Your surgeon knows best how your tissue quality is, and your physical therapist is going to obtain a protocol and op report from your surgeon and follow that protocol. So these are general guidelines. These are not a substitute for medical advice. So let's get started. We'll start with the shoulder anatomy. Just basic overview. So the most of the surgeries are around this ball and socket joint, as you can see. This is the joint where most of the surgeries take place. I think we can see better here. What's so special about shoulder joint is this ball and socket joint is not very stable by design. It's almost like a golf ball on a tee. The socket is very small and the ball is much bigger. And the joint capsule around the shoulder is very loose. That's why we have so much mobility in our shoulder. It goes in every which way. We have all this motion that allows us to use our arm. And for that mobility to be controlled and not cause any harm, we have lots of muscles around the joint, especially the rotator cuff muscles. Rotator cuff muscles are very important for the shoulder joint. If the cuff muscles are not working, and if I was to try to lift my arm, it won't be a smooth motion like this. I'll compensate by doing this and hiking and going up like this. Going back to the golf ball on the tee, what happens during the shoulder motion, when the arm goes up, the ball slides down on the socket to give clearance. If that doesn't happen, the ball will hit on this arch, part of this shoulder blade bone. And that's where pinching, impingement, pain symptoms come from when we are trying to use the arm. So again, during your rehab, when it's appropriate, we'll be teaching you a lot of exercises for the rotator cuff, but it's usually later in the rehab. Even though the surgeries are centered around this ball and socket joint, your shoulder joint is a complex. If you can see the collarbone attaches to part of this shoulder blade, and this collarbone also attaches to the breastbone. And then your shoulder blade is actually a floating joint on your upper back against the ribs. So your therapist will not just address this joint. Our body is like a fine-tuned machine. If one part is not working well, others are not going to work properly either. So your therapist will figure out which other joints are not moving the right way, and they will perform techniques accordingly to address the other joints as well. Now, moving on to some tips about shoulder surgery. First tip is try to get a pre-op physical therapy visit. Even before you have the surgery, go for a consult, talk to your physical therapist. They can show you some exercises before the surgery which will ensure better results after the surgery. And I'll be covering some of those exercises here as well. With the pre-op visit, other advantages, you can get answers to all your questions. It will help you be prepared, recognize what's expected after the surgery, how long of a sling use it's going to be, and what the precautions are going to be, what you're allowed to do and not do. Those are very important. Many times after the surgery, patients are explained what to do and not do, but because of pain medication or distraction because of pain, the attention is not there and we forget to ask questions. So if you are aware ahead of time, that's definitely helpful. It will help decrease your anxiety as well. Going on to sling use, typically 4 to 6 weeks, you will be in a sling. And many patients think once you're out of the sling, it's okay, the rehab is done. That's not true. That's the most protective phase of rehab. That's when therapist is moving your arm for you. You're not doing that much on your own. But shoulder rehab is at least 12 weeks to get you functional use of that arm. It could be a little longer for athletes to get back to their throwing, catching type of motion. With the sling, you want to make sure it's really taking the load off your joint. So the whole forearm should be supported in the sling. Elbow should be all the way back So you shouldn't have to hold your shoulder up. If you're doing that, it's not supporting. So make sure you're tightening the straps and adjusting your sling for maximum comfort and maximum offloading of the joint. And again, you don't want your shoulder rotated too far out, too far back. It should be more in a neutral alignment that puts the repair at a good angle for it to heal well. Some things you can do to improve your outcomes after the surgery, you can start before the surgery. That is to get some better pain-free motion. Better pain-free motion you have before the surgery, you'll have easier time to regain that motion after the surgery. Some very easy equipment you can use to achieve that at home are a stick, simple pulley system. They're not very expensive. You can buy them anywhere. And even a high countertop. And I'll go through all those exercises right now. Let's start with the pulleys. So if right shoulder is the one that's bothering you, that has pain with attempted movement, you bring the pulley on the right side first. Then you use your good arm. Your left arm is the force producing arm. Many times when we're using the muscles on the pain side, that's when it hurts. But if it can be relaxed and you use your good arm to stretch it out, you can get a good stretch and then gently back. So the pulleys can help gain that motion back. You want to do it in pain-free motion, strong but comfortable stretch. Some soreness is okay, but definitely no sharp pain. If you feel any of that, don't do it. And pulleys can be used for different motions. This is in front, and then if you take your arms out and then do this motion, you can get another direction moving for that shoulder. And as I said, easily available, not very expensive, and can make a big difference in your mobility. Next, I'm going to show you some exercises with the stick. These are all exercises where your good arm is helping. So you lay on your back. Again, if the right shoulder is the bad one, I'm going to lift it up with my left and then take it back. Right is basically going for a ride. Again, a good stretch. You can hold it a few seconds if tolerable and bring it back. And again, you can use the stick in different directions. You can take it out like this. You can rotate it like this. So if your elbow is by your side, you push on your hand and it gives you some rotation motion. This is not a high-low table for table exercises, so it's not going to be comfortable on my back, but I would recommend doing the next set of exercises on a countertop. So you put your arm supported on the countertop and then you step back. As you step back, you'll see the shoulders getting a good stretch. You hold it and forward. Stretch back, hold it, forward. Again, as I said, this table is a little low. So same thing, sideways. You can get a stretch sideways. Shift your weight to the side and it will stretch your shoulder. You can also get some rotation. You bend at your hips, flex your trunk, and you'll feel a good stretch in the shoulder. So these are some of the basic mobility exercises you can start before the surgery, and when the time is right after the surgery, your therapist will be teaching you again as well. Now let's move on to early phases after the surgery, what to expect. As I said earlier, you'll be in a sling and pain will be there. There's inflammation and healing going on. So you want to have some pain coverage, especially before your PT session. If you're more comfortable, we can get a little bit more motion there. Ice is your friend. Ice, ice, ice. Our goals during this phase of rehab are to protect your repair. That's why knowing your precautions, very important. What you're allowed to do, what you're not allowed to do. If it's a muscle repair, rotator cuff repair, you are not allowed to use the muscles for a while. Because if you tighten up those muscles, it's going to pull on the repair. And that's why therapist is going to move it for you. You're not going to start moving your shoulder right away. So you'll need help with that. That's the passive range of motion where your therapist will give you your motion back. So you want to protect the repair, you want to bring the swelling down, and you want to focus on improving the pain-free motion. As much motion per your protocol, we will improve that motion for first few weeks. During this phase, what patients have trouble with is finding a comfortable sleeping position. Most patients are able to get good sleep in a recliner, or if you don't have a recliner, propping up on a few pillows, supporting your arm in the sling on some pillows can make it a little more comfortable to be able to sleep through the night. Another exercise we can do in the early phase are called pendulums. It's very important for you to know the proper form of pendulums. Pendulums are when your arm is moving like a pendulum. Most common issue I see with that is patients will start moving their arm to get that motion. The key is in the trunk. So your arm is out of the sling, resting by your side, and you get the motion from your trunk. So you shift your weight from front to back, and as your body sways, your arm goes through the motion as well. So that's the important part, getting the motion from your hips and your trunk, not from your arm muscles. Pendulums can be done in different directions, front and back. You can do side to side, shift your weight from one hip to another, one foot to another, and you go side to side. And the third direction is you can do circles. So again, my whole body is going for a circle. My arm is as relaxed as it can be. Again, gravity is pulling on the joint, giving it some space, and that seems to be very comfortable. Most patients like pendulums when done right. One tip I have for you during this phase is relax. If you can relax while your PT is moving your arm, you'll get better motion. Many patients are very guarded during this phase, and that's the hardest thing I ask them to do, relax. But some tips which work for me, I will play some beach sound music, talk about their favorite vacation spot, distract them while I'm trying to go through the motion. If the muscles are relaxed, there's better motion. I know it's counterintuitive that it's injured, it's repaired, it's soon after the surgery, you don't want to let that motion happen, and that's why your body goes into that guarding mode. But if you can just breathe out and relax, that motion's actually helpful. If you're getting that motion, there's better circulation. It will help bring the swelling down. It will facilitate the healing. Again, going back to swelling edema management in this phase, repair is in the shoulder. So you're allowed to use your wrist and hand for most part. Your sling will come with a stress ball. Start using it. So you're pumping fluid from your distal arm to further up. So use the ball that comes with it. If the biceps is not repaired, you're good to go with elbow motion as well. Do some active elbow motion, forearm motion, all that will help with the swelling. Next, with the sling being around the shoulder, your neck will often get stiff, and that's the joint right above the shoulder. So you want to keep your neck flexible, and you can do some neck exercises, chin tucks, some stretches for your muscles, and keeping your good motion of your neck. So these are some of the exercises which you can easily do during the early post-op phase, first few weeks. Now, moving on to shoulder blade. As I mentioned earlier, shoulder blade is very important part of shoulder complex. So if the shoulder blade is not stable, if it's tilted like this, that's gonna increase the strain on the joint. We need a good stable foundation, that is the shoulder blade, for the humerus, for the long bone to move around it. A lot of exercises we'll teach our patients after shoulder surgery involve strengthening of these shoulder blade muscles. So shoulder blade muscles, we start with gentle isometrics, where you just squeeze your shoulder blades together and relax. Squeeze your shoulder blades together and relax. And these are some of the exercises, again, you can start before the surgery itself. One more key factor is posture. If I'm sitting like this, if I'm curving up my upper back and I try to move my arms, this versus this, what gives me better motion? Upright posture. So posture is another key factor which is directly related to range of motion and your shoulder blade position. So practice good posture. I know it's hard for all of us. We are on our devices down all day long, and that doesn't help, but making a conscious effort, shoulders back, squeeze your shoulder blades together, head back, all that helps with the overall recovery after a shoulder surgery. During your rehab, your therapist will teach you after a few weeks, once your surgeon permits, we'll teach you some exercises called isometrics, where you'll start activating the muscles, but no movement will happen. So if I'm blocking this motion, I'll use my fingers to block this motion. I can feel my muscles tightening up again. It's just 2-finger resistance. It's not a lot of force because the muscles are still healing after the surgery. We want to start activating them without putting undue stress. We're still trying to protect the repair, but after 4 to 6 weeks, the repair is pretty good, and we still don't need strenuous exercises, but we can start doing some. So these are safe exercises later on in the phase. So to bring it in, you block the motion. Again, you can use 2 fingers to ensure you're not exerting too much force, and out. One more tip I have for you is better communication. Make sure you communicate with your physical therapist how you are feeling. Sometimes patients come with the notion that no pain, no gain, and while we're trying to move the shoulder, they won't say anything and they're in a lot of pain. That's not always true, especially in the acute inflammation phase when your body is still healing. If we do too much, your body's going to go into full-on guarding mode. It's not going to help. It's counterproductive. I'm going to lose motion by being too aggressive. There's a fine line. Again, it varies from patient to patient. Some patients, we need to be a little more aggressive to get that motion back. Other patients, for most patients, we don't need to be aggressive. If we are gentle and not pushing your pain threshold, your muscles will stay calm. Your body won't go into a guarding mode and we'll get better results. So anything that helps you relax, try to follow that. Make sure to discuss your personal goals and limitations with your therapist. They'll have a bunch of pointers on how to make your life easy. One of those I'm going to share right now with winter weather and donning doffing jackets, putting them on. If my right shoulder is the painful one, it's much easier for me to start putting it on the right side. Start on the right, then I can easily put on the left because it moves well. But when I have to take it off, start on the left. I can use my elbow, then easily slides off the painful side without having to move this shoulder much. And later on in rehab, we'll focus on improving your reaching tasks. We don't realize how much we use a body part till it's hurt. I know that from experience. I recently broke a tiny bone in my toe, and every time I have to take a step, I know the importance of that little bone. Shoulder is a major joint for every activity. Once it's in a sling, we realize how much we use it all day long. So later on, we'll retrain repeated reaching in the closet, putting cans on the shelf, meal prep, all that we will integrate as part of our rehab. Again, individual goals for athletes, if throwing motion, we'll practice that as well. So that's all I have for you today. Thank you so much for joining me. I hope these tips were useful to you. If you have any questions or comments, don't hesitate to leave a comment below. Bye for now.